So we have Dr. Brian Davey here. He's going to make everyone smile and everyone's life happier because he represents complete health dentistry and health dentistry during COVID. So that you can go from these COVID masks when this is over to your usual radiant self with a healthy mouth, a healthy attitude, and all kinds of advice from Dr. Brian Davey. We welcome you to Rancho Santa Fe Rotary.
Thank you so much for having me today. Thank you to Rancho Santa Fe Rotary. Congratulations to President Robin. Thank you, Norma, for helping coordinate everything, and for Viral and Stephen King at Future Legends for bringing this topic to Rancho Santa Fe. I'm really happy. Amy, who talked earlier, I loved your quote, and my quote for today is: the difference between happy people and unhappy people is their level of gratitude. And I'm really grateful for being here. And I heard you guys talking about your happy bucks, so that's pretty awesome. So I'm going to share my screen here, and I've got it for the presentation. I wanted to make sure that if you have questions, to write them down. I'm going to go through all the topics, and at the end, hopefully we have some time for some question and answer after I play a little trailer. Okay, so just give me 1 second here to share screen. And I think we're going to go right here. Give it a play. You guys see my screen okay? All right, so thank you. My whole goal is preventing the preventable. My name is Dr. Brian Davey. I've got 2 offices here in San Diego. I'm a fellow in the American Academy of Oral Systemic Health, and right now I think I'm the only private dental office that's a Live Well San Diego partner. So partnering with the San Diego County program of Live Well to help safe, thriving, healthy, and well communities goes right along with my personal philosophy. The 2 most important days in your life are the day that you're born and the day that you find out why. And I feel pretty lucky in that I get to live my purpose, serving the community. You know, my goal is to enhance the complete health and wellness of our community and making a difference in your lives and the lives of my patients in our community. And my team, our vision is that we want to make San Diego the healthiest city in the U.S. And we're going to do that by our core values are the word teach. So technology, educate, advocate, celebrate, and hero. So we're all heroes working together to be a part of your healthcare team. So healthcare team needs to include your dentist. Your mouth is connected to your body. And so dentists really need to be part of the medical team because it takes a team approach to achieve wellness. San Diego, obviously, we're so lucky that we are quarantined in San Diego. If we had to be anywhere else, at least we're here in our wonderful San Diego, America's finest city. And our goal is that we make San Diego not just America's finest city, but America's healthiest city. So I wanted to give you all some updates on COVID-19 in dentistry, because there's a lot of information and sometimes confusing information out there. So I wanted to share with you the state of affairs of dentistry in San Diego County. On Mother's Day weekend, the county public health officer basically released dentistry to be open with restrictions. And I call it slow your flow is kind of the philosophy. So dental offices are able to open now to provide elective care for postponed dental treatment, as well as preventative care, which includes periodontal therapy, as well as your preventive maintenance, like getting your cleanings. And how we operate to keep you safe and to keep our team safe is we've implemented a certain number of steps that you'll see at most dental offices across San Diego. We implement what's called a telephone screening, and there's the questions that you're probably getting answered in your daily life as you venture out, if you've been to the doctor or different places. Asking where you've traveled and if you encountered anybody ill and how you're personally doing. So we first level of defense is just on the phone, because in San Diego right now, we're not treating active COVID patients. We're only treating patients that are feeling well and not having any of the symptoms. So the next step is in-person screening. So the same questions that were asked on the telephone a few days before your dental appointment are going to be asked in person. Every employee that comes in at the beginning of the day gets the same screening questions, as well as a forehead temperature check. And then patients will come in and will also go through the screening, have their temperature taken. Dental offices, we've restricted our flow, so we have a lot less people moving through the dental office, space between appointments for social distancing, as well as giving time for the team to really clean the rooms. You'll notice a lot more barriers. You know, I lovingly call them the sneeze shields that you're starting to see all over society, the big plastic barriers. And then in dentistry, your hygienist and your dentist and people working in the dental office are going to look a little different than they did before the pandemic. I call it the spacesuit. So we're completely covered in PPE. You know, PPE is the term that people were hearing at the beginning of the pandemic, where hospitals and doctors' offices weren't having access to that. And through the Dental Society, pretty much every dental office that wants to be open has had access to proper protective equipment. The next thing that offices are doing in our office, we don't want to just meet the standards for safety, but we want to go above and beyond. So there's things called a hypochlorous acid, sounds scary, fogger, but it's basically almost like a steam fogger that goes into the operatories and surfaces and helps disinfect the surface, so any surface contact. Also UV lighting in people's HVACs on the roof, and UV lighting in the rooms, because UV lighting also kills the COVID virus, as well as high-level surface disinfectants. And kind of the boogeyman in dentistry right now is aerosols. So that's one of the reasons why we're sitting 6 feet apart in social distancing, is these aerosolized drops. So in dentistry, what we've done is increase the airflow in just the HVAC of our offices. So we're really increasing ventilation, as well as putting UV filters and HEPA filters in our air conditioning units. And then when we're having dental procedures that might create an aerosol, we have actually high-level suction right in front of the patient. And that's able to capture 95% of any of the aerosols that are generated during a dental visit. And then any of the other 5% that might be around is we've implemented medical grade HEPA filters in every operatory down to 0.1 micron. So that's filter size smaller than the actual virus itself. So these are the things that most dentists are putting into place. And some offices are going above and beyond just to protect you and to protect our teams. So the question is it safe to return to dental offices? And the answer is yes. So there's a picture of, for me and my team. Like I said, you look a little different than we might have before the pandemic. You know, obviously covered with face shields and N95s and a mask over the N95 and surgical gowns and gloves. And dentistry as a whole has been really great, even before the pandemic, with universal precautions. So we've always taken a real high level of infection control. And so it wasn't a big leap for us to be able to mitigate the next levels to keep you safe. And MIT came out and said that dentist offices are the second safest place to return during the pandemic. So you can rest assured that your health is really important and your safety as well. The reason why that's so important in getting back to the dentist is because we know that there's a big connection between the health of your mouth and the health of your body. And there's 12 facts you can't ignore, is that there's a big connection between Alzheimer's disease, heart disease, certain cancers, organ damage through periodontal disease. You can have an infection in your mouth, and if you're having a knee replacement or a hip replacement, those bacteria can find their way into your joint and cause failure of the surgery. Connection with diabetes and oral health, and also just lowering your overall healthcare dollars by staying healthy. We know that in America, the #1 cause of death is cardiovascular disease. And there's a lot of risk factors that we're pretty familiar with. What most people don't know is that most of these can be prevented with lifestyle changes, including maintaining a healthy mouth. We know that changes in periodontal treatment lowers hospital admissions and lowers annual healthcare dollars spent. So patients who have had a stroke and maintain a healthy mouth and free from periodontal disease average spending $5,000 less on their healthcare a year, and $1,000 less a year for patients who have heart disease. So we know that periodontal disease directly linked to arterial inflammation. And inflammation is the underlying cause for most of our chronic health problems that we have. And we know that the periodontal pathogen, so the bacteria in our mouth, can affect your blood pressure and are linked to heart attack and stroke as well. And we have the research to back it up. So now that we have level A research, which is the highest level of research that connects periodontal disease independently associated with arterial disease. And arterial disease is how we suffer from a heart attack and a stroke. So that we know that oral bacteria can cause gum disease and tooth decay are found in 75% of one study of heart attack, the blockages that linked are causing the heart attack. Or oral bacteria have been found 16 times greater concentration in the actual blood clot than in the bloodstream. And one study found that 50% of people who had heart attacks had a current dental infection. So the health of your mouth can really affect your overall health and put you at risk. One of the other connections with a healthy mouth is a connection with diabetes. And diabetes is a big impact on our healthcare system. 1 in 4 people that have diabetes don't know, and more than 1 in 3 adults in the US are pre-diabetic. And that the other connection is that 95% of people with diabetes also have gum disease. 1 in 5 healthcare dollars are spent treating people with diabetes. And by treating gum disease lowers the annual medical cost for people with diabetes $2,000 a year and lowers hospital admissions by almost 40%. And so we know that not only just keeping healthy, but supporting our healthcare system, which is obviously under pretty tough burden these days. We know that in the oral systemic link with diabetes, that insulin resistance is the root cause of 70% of heart attacks and strokes and almost all types of type 2 diabetes. And that insulin resistance is really an inflammatory disorder that damages the lining of your arteries, and inflammation coming from gum disease can be a contributor. So by controlling our periodontal condition really helps to lower our risk for diabetes. So there's also a big connection between your oral health and Alzheimer's. There's a big connection with some studies that have recently come out connecting the types of bacteria that are found in your mouth. There's a couple of different types of bacteria. One are called spirochetes, and some studies have been associated with dementia. The other type of bacteria that we'll get to in a second is Porphyromonas gingivalis was actually found in the brains of Alzheimer's patients. And Alzheimer's has a very big impact on our society. As you know, it's the number 3 cause of death in the US, and 50 million people are living with Alzheimer's, will develop Alzheimer's, and 1 out of every 7 people. And unfortunately, it's a terminal disease, which there's no cure. So we really want to work as much as we can on prevention. In dentistry, we really work on treating the root causes of dementia and Alzheimer's. So dentistry, fighting gum disease. Gum disease causes local inflammation as well as inflammation in your body. One of the other things in a complete dental health office that we're screening for are sleep disorders. Lack of proper sleep increases your risk for Alzheimer's and dementia. Your ability to control your blood sugar, we know that it's linked to arterial disease. And a recent study even has come out linking periodontal disease with gut health. So, gut health is really important part of our overall health. And then dentists, we can support patients in exercise, nutrition, getting good quality sleep, and a lot more. So these are just a couple articles that have come out supporting the health of your mouth and the types of bacteria in your mouth and how it's linked to Alzheimer's and dementia. And this last study was pretty groundbreaking in last year, where they were actually finding whole bacteria in the brains of Alzheimer's patients, and they weren't finding this type of bacteria in patients that didn't have gum disease, as well as the toxins from the bacteria and the proteins that are released from those bacteria. And so we have the ability in dentistry nowadays with a simple saliva test just to tell us what type of bacteria in our mouth, and so we can tell if patients have the high-risk types of bacteria, and you can share that information with your doctor as well as your dentist to move towards a healthier mouth. So in our office, you're able to screen patients for sleep apnea. 60 million Americans have sleep or wakefulness disorder. We know that sleep apnea is associated with diabetes, asthma, acid reflux, high blood pressure, weight gain, heart failure, and even car accidents. So getting a good night's sleep, what's in a good night's sleep? We want to know if your dentist is going to ask you, how well are you sleeping? Do you sleep like this? Or do you sleep like a baby? And for some people, sleeping like a baby might be tossing and turning and crying all night. Or your sleep might be affected by somebody that your significant other could be affecting your quality of sleep as well. Or we know that some people have to sleep with a CPAP machine. CPAP is the first line of defense for sleep apnea, but obviously sleeping with a CPAP machine can be sleeping with Darth Vader, so it can affect your quality of sleep as well as your partner's quality of sleep. So if you want to wake up with a smile, don't give up. We have some options. The first thing is really to work with sleep hygiene. We want to create some habits that facilitate a good night's sleep. We want to make sure that we limit our naps, even though on the weekends a great nap is awesome. Avoiding stimulants and alcohol. Exercise, but not too close to your bedtime. Avoid eating before bedtime. Make sure that in the morning we get exposed to natural light, and that establishing a good bedtime routine. And obviously avoiding your phone or your iPad or your computer at least 1 hour before going to bed. And then for patients who still might be struggling, they've incorporated all good sleep hygiene and they're still suffering with not getting a good quality and quantity of sleep, we might be suffering from sleep apnea. So patients who have excessive sleepiness during the day, decreased memory, poor sleep at night, snoring, or waking up gasping, you might have sleep apnea. So there's other risk factors associated with sleep apnea: being overweight, having a large neck or small jaws, having high blood pressure, nasal congestion, smoking, alcohol consumption, or sleeping on your back are all additional risk factors for sleep apnea. And some of the consequences of sleep apnea are the same consequences of untreated gum disease: heart disease, high blood pressure, stroke, cognitive damage like Alzheimer's and dementia, can affect sexual dysfunction. First, you have to be in the same room with a person. If we're snoring and having sleep apnea, it can be pretty tough. And increased risk of motor vehicle accidents as well. So the ramifications to poor sleep affects our whole society. Increased risk for motor vehicle accidents. A lot of people are out there driving drowsy. 8 million Americans fall asleep at the wheel, and the estimated cost for untreated obstructive sleep apnea is $150 billion, and that's supposed to be 2015, not in the future. So $150 billion is pretty significant impact to our healthcare costs. And then, so how do we get treatment? If we find somebody that we think might have snoring or sleep apnea, you can have in-home testing. You can be sent home with a sleep test, or you can go to a testing center. And then we have options these days. So it's not everybody doesn't have to end up with a CPAP or have surgery. You can actually have a dental device that helps you breathe at night. And they're called mandibular advancement devices. It's basically kind of like a night guard that just helps your jaw move forward and keeps your airway open at night. And a lot of patients find it more convenient and comfortable than wearing a CPAP machine. And it has the FDA approval for preventing mild to moderate sleep apnea. And so how dentists can help in the arena of complete health is really prevention. So we really coach our patients on stress management, food, diet, nutrition, being their cheerleader for getting exercise, and also the quantity of healthy sleep too. We know that by treating gum disease and dental problems that we're reducing medical costs as well as hospital admissions. And really our goal is that we want to bridge the gap between dentistry and medicine, as well as bridging the gap between disease and health. And it's possible to have a disease-free mouth and to really have your oral health support your overall health. And so dentist offices and complete dental health offices, when you see your hygienist, They're screening you for gum disease, oral cancer, diabetes, heart disease, sleep disorders, eating disorders. And we always say, and you thought you were just getting a cleaning. So there's some things, it's not all doom and gloom out there. You can work with your dentist and your hygienist. And one of the other ways that you can maintain a healthy mouth between your dental visits, there's something called a periprotect trays. And really what we're doing when we're fighting gum disease, you'll notice in the middle here that bacteria in your mouth form layers. Almost, it's called a biofilm, almost like an onion. And so in between your dental visits, we're going to be building up these bacteria and these biofilms. And even sometimes brushing and flossing is just not enough to control gum disease. So you can have your dentist or your hygienist make these custom fit trays. And what we do is we place hydrogen peroxide gel in the tray. What that does is it creates a high oxygen environment. The bad bacteria, the anaerobes and the spirochetes don't like it, and the healthy normal bacteria proliferate, and so it helps to support a healthy mouth. That breaks down the biofilms. It kills the bacteria that are associated with heart disease, stroke, Alzheimer's, diabetes. So that's a pretty simple way to stay healthy in between your dental visits. And this was just a case study. Patients usually like to look at tooth pictures and then they want to notice how white the teeth get, but dentists are really looking at the amount of inflammation. So if you look at the top picture to the bottom picture, just a significant decrease in the amount of inflammation in a patient's mouth. Left untreated, the patient with the picture on top is more likely to develop a lot of the problems that we talked about. And so, my goal is that we can bridge this gap. We can help our community be healthier and really push us towards having San Diego be the #1 healthiest city in America. And we can't do it if we don't have good oral health. And so I want to play a trailer here for you. So bear with me one second while we make the link.
Can America be a vibrant country with a high standard of living?
Hold on one second. Are you guys not seeing the screen there? Are you able to see the screen? Okay, hold on one second here. One of the first signs of COVID is inability to make Zoom work when you want it to. Or did it pop up?
Still no, it's not showing.
All right, like I said, so I won't be sharing with you our our screening of that. I will get that to you as an email. It's a really great trailer. It's called Say Ah, and it really talks about a lot of the topics that I was sharing with you today, and how it impacts our individual health, impacting the health of our community, and that dentistry really needs to be part of your overall wellness program if you want to live a long, healthy, active life free from chronic diseases. If you're addressing, if you're eating well, you're exercising, you're seeing your doctor, and you're doing everything you can and leaving dentistry out, you're not going to be able to achieve all your healthcare goals. So I want to thank you all for your time. If you have questions relating to anything that we talked about, I also wanted to mention, I didn't have a slide on it, but I'm also the team dentist for the Monarch School. And so our office participates in helping the kids at the Monarch School. We go down once a year and we screen all 250 to 280 kids. And then at my 2 offices, twice a year, we take vans and we bring the kids up to our office and we provide them free dental care. Unfortunately, because of the COVID outbreak, we're unable to do that right now. So we're hoping that, things can calm down and we can have some different ways to mitigate, to help the kids that are affected by homelessness downtown. And that's our side mission. I know you guys were sharing with, what we're doing downtown to help people. It's really the COVID disease has really impacted so many of our patients out there throughout the whole community. So thank you.
You have time for a couple questions?
I do have a
Absolutely.
Just a second, before we go into questions, a couple people have texted me and said they have to go. It is 1 o'clock. So I want to thank you all for coming today. And Brian, thank you for offering to stay later to answer those questions. But
Sure.
if you do have to leave, thank you for coming today. And I don't know if Bob is still here, is he? I think he left. His birthday was this week and I didn't get to announce it. So we'll sing to him next week. Okay, you guys, thank you. And please stay and have your questions answered if you can. Thanks, everybody.
I have a question. Can I ask a question?
Absolutely.
Four-way test? Oh, okay. We do need to do the four-way test. Elizabeth's right. Let's have Sabi do the four-way test for us if he's still here. And the rest of us can stay around. Are you still here, Sabi?
Unmuting myself. There. Please join me in reciting the Rotary four-way test. First, is it the truth? Second, is it fair to all concerned? Third, will it build goodwill
and better friendships.
Fourth, will it be beneficial
To all concerned.
Thank you.
Thank you, Sabi. Thank you, everybody.
Okay, so I asked my question. This is Jamie. I have been told, and I can't remember the source of this, but someone long time ago told me that all the bacteria in your mouth also helps very much with your probiotic. So I always thought some of those bacteria are actually good for me. This is the first time I've heard how much of all of those bacteria are actually bad for my health. Could you tell me about that?
Absolutely. That's a great question. So there's the balance of good bacteria and bad bacteria. We need bacteria. We have bacteria colonies all over our whole body and different bacterial species. You know, in the mouth, there's right now somewhere between 800 and 1,000 different types of bacteria. And so you mentioned probiotics. There's probiotics that help your overall gut health. As soon as you pass the lips into the mouth, we're at the first stage of your gut. And so there are normal healthy bacteria that we want to have in our mouth. It's another reason why we don't really want to use antibiotics to fight gum disease for a couple reasons, because antibiotics wipes out all bacteria. So to answer your question, there are normal healthy bacteria in your mouth and in your gut, and probiotics, working with your doctor, your nutritionist to make sure you're taking the right ones. We need those. So there's of the 800 to 1,000 different types of bacteria in our mouth. They call it the dirty dozen. There's really about 12 of them are the culprits for gum disease, and as well as for dental abscess, or if a tooth dies that becomes necrotic, and that's also abscess. So there's really 12 really bad bacteria that we want to, when you go to get your teeth cleaned by your hygienist, they're breaking up the bacterial colonies. And it takes about 3 to 4 months for the bad actors to show up. So the first rounds of bacteria are normal, healthy, and over time, the metabolic byproduct or the waste product of normal bacteria provide an environment for different actors to come in. So, the dentist or hygienist, or when you get your teeth cleaned, we're breaking up the bacterial biofilms, getting back to just the normal healthy layers. And that's one of the things that the hydrogen peroxide therapy with Paraprotect does, is that in between your visits, it's maintaining a high oxygen environment, and our normal healthy bacteria love oxygen, and the anaerobic bacteria and the spirochetes don't like that. So that's how we maintain a healthy balance.
Okay, thank you.
Paulette.
Yes, doctor, I have a question for you. I don't know what the facts are historically. So when you go to a medical doctor, they can see you for everything pretty much, except if they cut your neck off. So it's like your insurance covers everything, but your brain, unless it has a tumor, because mental health or dental health, it's like somehow we've extracted. Oh, but if you break an arm, you still go to the medical doctor. You don't go to a dentist to fix the bone. But if you break a tooth, it to me, it makes no sense why we don't treat the entire gamut of healthcare as medical care. Like, why is it separated out?
That's a great question, and I ask that every day, and I ask that of when we go to talk to government officials and politicians and insurance, for whatever reason, like you said, that like our mouth has been detached from our body. Really, periodontal disease is a medical problem with a dental solution. It's a chronic low-grade infection in your body. So yeah, unfortunately, historically, that's been the case. It's something that I'm really passionate about, fighting for patients to get medicine, to your medical insurance to cover your medical problem that has a dental solution. And then that's why I shared some of the healthcare dollars, those healthcare dollars that are saved by treating gum disease and dental abscess ultimately save healthcare dollars to insurance companies. So
Yeah,
keep asking that question of insurance companies and politicians, because that's the fight that needs to be ongoing.
Yeah, that's a personal impact on my family. Both my dad and his dad died of heart disease, and guess what? They both had periodontal disease. Started in their 30s, but my dad had his first triple bypass when he was 43 years old, and he lived another 30 years, but he had false teeth in his 40s because he didn't take care of his teeth. And so yeah, it's a very personal thing to me. And I have a son with autism.
Uh-oh, you froze up, Paulette.
Yeah, there's obviously heart disease and stroke and Alzheimer's. Really, I don't know if anybody escapes that, as far as having somebody that they know or somebody. For Paulette, there's a great book called "Beat the Heart Attack Gene," and one of the things I didn't really get into because for time, but there's a big genetic component to your susceptibility to disease, to periodontal disease, to chronic inflammation. So there's a book by Amy Doneen and Brad Bale on how you can beat the heart attack gene. Like heart attacks and stroke, most people feel like they're inevitable, especially if you have a genetic history. So it's not inevitable. And in the book, they go into a lot of detail. And I'm happy later, if you want to reach out to me, I'm really passionate about wanting to prevent the preventable. And if there's anything that I can do to help prevent somebody from having a stroke or having a heart attack or developing Alzheimer's, that's why I said I'm lucky I get to live my passion. That's what I love. So I know we ran out of time, but reach out to me. I would love to share more.
Thank you. I'm looking up the book right now.
I have a question, doctor. I had a knee replacement a year ago, and I take, I think it's amoxicillin or something like that every time before I go to the dentist. And do I have to do that for the rest of my life? Some doctors say yes, some say no. And I'm not a big fan of taking any kind of antibiotics if it's not totally necessary.
Yeah, it's a controversial subject in medicine and dentistry. And medicine and dentistry are over here, and surgeons are over here. So if you ask a orthopedic surgeon, they're going to tell you Keflex for life. The more progressives are starting to get away, after a year or two. It really just kind of depends on your own risk factors. If you have other underlying issues that could affect your immune system, they're going to want you to pre-medicate before your dental visits. And then if you have fewer of those, then you can talk to your doctor about not necessarily taking it. Because when you do take 2 grams of amoxicillin, you are wiping out some of your normal healthy gut bacteria. So
I know.
if you do take it, make sure you take a probiotic as well along with it.
Okay, thank you.
Dr. Davey, how do we know if we have sleep apnea? What are there symptoms to look for, or, what if you think you wake up in the morning and you're fine? And what is the difference between sleep apnea and snoring?
Yeah, I'll take that one. That one's let me answer the second part first. So snoring is loud vibration of your airway due to narrowing of your airway. So that's the noisy snoring, loud snoring that you'll hear. That can actually impact the quality and quantity of your sleep. Sleep apnea is when your airway narrows and it gets so narrow that when you take a breath in, it closes off like you're pinching off a straw, and that where you stop breathing. So some patients are stop breathing for a minute or 2 minutes, up to 5 to 25 times an hour, and even more. So that's what sleep apnea is, when you actually stop breathing. Patients with sleep apnea, typically, even if you get 6 or 8 hours of sleep, still are tired all day. You might, if it's a quiet room and you're sitting still, might doze off. We ask patients if they sit at a long stoplight, dozing off, or if you're, just excessive daytime fatigue. If you're hitting the coffee all day long and still are feeling tired, it gets us asking more questions. From a dental standpoint, we can see the signs in your mouth of people that might have snoring or sleep apnea, because it's almost universal. Patients with snoring or sleep apnea grind their teeth. And I work in the airway all day long. And so we are able to see position of tongue, how much of your airway is open or closed. And so that also gets us asking questions too.
Thank you.
Well, I just wanted to say we sure appreciate having you today, Dr. Davey. And I don't think there's many dentists like you that cover all the gambits of health from head to toe like you have today, and especially things like Alzheimer's and heart disease. And you're right, most of us just go to the dentist in and out and want to get our teeth clean and we're done. And I've never had a discussion of any of these things with my dentist. So really, really appreciate this. We've learned a lot. And I see Paulette put the name of the book up there. And you should probably post Dr. Davey's card so we can all have it if we would like to go see him. I really, really appreciate you being here today. And I'm so glad that we had so many of us that could stay longer and talk to you.
Absolutely. Thank you so much. I really appreciate the opportunity to give out the good information, make San Diego the #1 healthiest city in the U.S.
Thank you, Dr. Davey. Come back anytime.
Well, thanks. Remember, a healthy mouth supports a healthy immune system, which is very important these days.